these are kind of fancy, but derealization and depersonalization. Has anybody ever heard of those? You might have experienced them before. You may not know what they are, but derealization is kind of like where it seems like everything around you is a movie. Somehow it's not real. It's an interesting thing that your brain does. And the other one, depersonalization, is kind of like when you're outside of your body. Maybe it's like you're up above yourself, watching yourself, go about your business. Those things can happen in different types of disorders as well, but with panic attacks, they occur sometimes. The next thing, the physical symptom or other symptom that you have to have or have to have one of is fear of losing control or going crazy. That sort of depends on the circumstance a lot of times. The next one is a fear of dying. Numbness or tingling is another one. A lot of times that's around the fingertips or around the mouth, and I'll explain why that is in a second. And then finally, chills or hot flashes. That's the last one. So there's 13 of these things. If you have 4 or more, and you can see it's pretty easy to have 4 or more probably when you're having a panic attack. Most people have 4 or more of these things. Even when you almost hit somebody with your car, you have 4 or more of these things, right? Usually when people have a panic attack, they get this they feel like they're in danger, and they have sort of, like I said, this maybe a sense of impending doom, like something really bad's going to happen. And then they get an urge to get away, which it's the fight or flight reflex, right? So it makes you feel like, I got to get out of here kind of quick. Let's talk for a second. Hopefully you were thinking through those symptoms, and you were trying to think, now, why would I have those things? What would the purpose of those things be? Part of the treatment of panic disorder is doing exactly what I'm going to do now, which is explaining why you have these symptoms, so that people realize that, number one, I'm not going to die from them. That would sort of defeat the purpose, right? I mean, if you had a panic attack and you died, it'd be like walking through the woods and come across a lion. Oh my God! And you die, right? Well, it saved the lion the trouble, I suppose, but humans wouldn't survive, right? I mean, every time we had a panic attack, we died. That's not so good. So to try to reassure people that are having panic attacks as part of panic disorder, that's part of what we do, is to reassure them that this is a normal process and you're not going to die from this. Now, of course, that's not absolute. I suppose if you're somebody that had major heart disease or major other issues that physically were very, very ill, there's a higher chance of you dying for any time your heart rate goes up or your blood pressure goes up. But in general, people don't die from panic attacks. These physical symptoms. So let's think about this for a second. If you're going to fight or run away from something, what do you need to have? What does your body, what do your muscles use? Well, they need blood, right? They need a lot of blood. They need oxygen in that blood for energy, to gear up so you can be as strong as you can be and as fast as you can be and all these things, right? So your heart has to beat faster, and it has to beat with more pressure. So that's why it feels like it's beating out of your chest, because it really is beating hard. Your blood pressure probably is pretty high at that point. It has to be, to get the blood to the muscles so that it can do the best, so that it can support those muscles in their job to get you out of that situation, whether you're fighting it or running away from it, the lion or whatever the threat is. So that's the first thing. The next thing, like I said, you have to have oxygen, right? So you have to breathe. You start to hyperventilate usually. You breathe real heavy to get the oxygen into the blood and to where it needs to go. Shakiness, what does that come from? That's from the adrenaline. The adrenaline is what causes your blood pressure to go up and your muscles to, you obviously you've heard about people doing superhuman things when they get under a lot of stress, right? Ripping a car door off its hinges or something like that to save somebody. I mean, these things are because adrenaline kicks in and it gives you pretty good strength, okay? So the adrenaline, though, can cause shakiness. I don't know if does anybody take any adrenaline-type medicines for asthma or chronic lung disease or anything, these inhalers? Those things will make you shaky sometimes. It's the same kind of thing. It's the same sort of mechanism. What else? Let's see. I didn't mention this as one of these symptoms, but your pupils dilate when you have a fear reaction, because of this fight or flight reflex, because you got to bring in more light into the retina so that you can see as well as you can see. Start to sweat because you want to keep your body cool while it's obviously when your blood pressure and your adrenaline's flowing like that, you might have hot flashes, you might get pretty warm, so the sweating helps with that. Now, I think these other ones are kind of weird, and I'll admit this is kind of goofy to talk about, but why would you have nausea and vomiting? Do you want your body to be spending a lot of energy digesting food if you've just eaten a big meal? Probably not, right? I mean, you don't want to use the energy on that. You want to use the energy to fight this lion or run away from it, right? So your body has this built-in mechanism that makes you get rid of all that, okay? So usually in a panic attack, most people don't vomit, but they'll at least get nauseated. And if it's a severe stressor, some people will vomit. And that's to get rid of the food so that the body isn't shunting or putting blood. That's what happens when you eat. Your body pushes more blood into your bowel and into your stomach and all that, so that it can absorb, so that the blood is there for the food to be absorbed up into. Well, you don't want to do that when you're having a stress reaction, a panic attack like this, so sometimes you'll vomit to get rid of it. The other reason that you might vomit is because if you just ate a big well-over's meal and you have a pound of steak sitting in your gut, yeah, that's a pound that you don't need if you're trying to run from this thing, right? And this is going to be goofy too, but same thing with stool and urine, right? Why do people lose their bowel and bladder sometimes in extreme stressful situations? Because you don't want to have extra weight in your bowel and your bladder or your stomach if you're going to have to run away from this. You want to be as light and as agile as you can be. So this is why in extreme stressful situations these things happen. So hopefully that explains a little bit. This is sort of the normal process, but realize that a panic attack, well, you wouldn't call it a panic attack if there was a lion. I don't think. I don't know. Would you guys call it a panic attack if a lion was standing in front of you? We wouldn't. I don't think we'd call it fear, or we'd see that as normal, right? It's a normal reaction, or just when you about had the accident. That's sort of a normal thing. We all sort of know what that is. The problem comes when there isn't anything in front of you scaring you like that, and you have one of these things. Imagine that for a second, boy. You're sitting there watching TV, or you're sitting there on the job, or you're going to Walmart, and you're standing in line at the checkout, and all of a sudden you start feeling this panic attack, this fear reaction, like there's a hungry lion, but there isn't. You're looking around and trying to figure out what the heck is going on, and your chest starts to hurt. Next thing you know, you're in an ambulance going to the hospital. So let's talk for a second, real quick. When these panic attacks are unexpected, like I just talked about, that's when they cause problems. Okay. They can also be related to something else. Let's say they're related to, if you're afraid of snakes and you see a snake. If it only happens when you're seeing a snake, it's probably not panic disorder. Okay? If it only happens, I don't know, when you relive we're a prisoner of war at some point, okay, and you've heard of post-traumatic stress, and then you watch a movie about a prisoner of war or something, and you start to have a panic attack. If it only happens in those situations, it's not panic disorder probably. It's related to the post-traumatic stress. Incidentally, we'll talk about that disorder next month. How many people? First of all, I guess, is it possible for somebody to have a panic attack and not have panic disorder? Does anybody know that? The answer is yes. About 7% of adults in the United States have had a panic attack at some point in their lives, and about 5% have had recurrent panic attacks, but not necessarily panic disorder. So they'll have 2 or 3 or more, but they're not. Maybe they're not close together, and they're not enough to make panic disorder. Well, about 3.5% of adults, patients, I always say that, 3.5% of adults in the U.S. Have panic disorder. Okay. Last time I started a little thing where I was going to give you guys some examples of cases, and I think I'll do that again today. It's kind of a neat little thing to sort of. Somebody had asked me, I guess, last time about what does a psychiatrist do when they see somebody and all that. And sometimes these cases are I've put stuff in these cases that make it sort of real world, like the person, the stuff that the people that I really saw in my practice. But of course, the names have been changed to protect the innocent. Actually, what I've done is these aren't actual real cases of like one person. It's a mix of different things. Okay, so it's like sort of I've made up a classic case that I see routinely, but it's not like any one particular person. So in a small town, you got to worry about that. I guess you don't want to break any confidentiality. So let me just read you this little thing here. This is a 20-year-old man who presents to the emergency room complaining of having had 3 times in the past month where he was in a crowded checkout line and he felt a sense of impending doom and the need to get out quickly or that something bad would happen. He had a sudden peak of anxiety with a racing heart, inability to catch his breath, dizziness, shakiness, chest pain, and a feeling of smothering. He had to leave the line each time, and the panic feeling went away within a half an hour. He's now afraid of having this feeling again and is avoiding going to stores. You hear the avoidance here, because avoidance is something that really causes a lot of problems.